Good morning and welcome to Veterans Heartbeat on the Pulse of the Veteran, where we discuss issues of health, happiness, opportunity, and well-being of interest to the veteran community, their families, and the community who honors them.
Good morning and welcome to another episode of Veterans Heartbeat, brought to you by River, the Rural Institute for Veterans Education and Research. My name is Jason Zencraft. My co-host Ed Lasofsky is here with me, and he's the Executive Director of River. We welcome you to a weekly wide-ranging discussion of issues, events, opportunities, and needs in our veteran community. Morning, Ed. How are you doing?
Good morning, Jason. And by the way, happy belated birthday.
Oh, thanks. Yeah, I'm getting older every day. Gotta love it. We'd also like to thank our other sponsor, The Man Shop. It's a great place for a guy to get a haircut. If you do need a haircut, swing on by and check them out. The gals there really do a good job. As stated before, we're also brought to you by River, the Rural Institute for Veterans Education and Research. They offer many services such as a weekly free TBI and vestibular disorder testing and educational programs that focus on veterans helping veterans. So if anyone's been paying attention to the current legislative session, they might have seen House Bill 612. So House Bill 612 allows EMTs, or emergency care providers, to gain additional training so they can provide care to veterans in areas that don't have the necessary services. Ed, do you want to explain the bill in further detail, what it's all about?
Quite simply, Jason, there is not enough care providers in the rural areas or even in Montana for veterans. This bill will allow for EMTs, ECPs, is what they call them under the law, emergency care providers, to go out and provide medical and mental health screening for veterans.
So emergency care providers get trained up in a multitude of other areas, from crisis and suicide intervention to emergency care, how to refer somebody if they do have a severe mental health issue, pain and stress management techniques such as medication management, exercise, nutrition, and how to refer again as well. A lot of the services will need to be referred out, but some of them can be handled from the ECP. They also get trained up in benefit programs for veterans. A lot of veterans don't understand what they qualify for from, educational benefits, health care, things like that. So,
if you guys remember, Mike Garcia from the VA was on the show talking about the confusion over veterans benefits. Don't forget to call the VA at 406-442-6410 and ask to get information on your benefits.
Yeah, absolutely. It's really important. There's a lot out there. A lot of guys and gals don't know what they really qualify for. So to wrap it up, basically, these emergency care providers have this training in all these different areas, from mental to physical health and a few other areas, and they can go in the rural areas and work with veterans who may have to drive 5 hours to the closest VA hospital and 5 hours back. Instead of that, they'd have an ECP in the area with enough knowledge to coordinate their care. So now we're going to visit with Nick Bradford, the Assistant Director for Glacier County EMS. How are you doing?
Good. How are you doing?
Not too shabby. Thank you. So tell us a little bit about what your crew's doing in Glacier County.
So in Glacier County, we recently started a program that has some similarities to what the state's looking at right now, to where we take care personnel and send them out to people's homes to do a variety of services. It's meant to and is increasing access to health care for a great number of people.
Okay, great, Nick. Well, that's good to hear. Ed, do you have any questions for him? I know there's a lot of confusion between Chapter 50 and Chapter 37, even in the EMS world, but especially to the average civilian who doesn't know anything about EMS. Do you want to kind of go into some detail about the difference between the two and what they are?
Well, before we hit that, Jason, let's talk to Nick a little bit about what he is doing up there. Nick, we have a House bill sponsored by Mike Hopkins, co-sponsored by a number of legislatures, and really being pushed by Representative Cargella in the legislature, that allows for veterans to receive community paramedicine. And there was a lot of confusion as to what community paramedicine is and is not. So you, as a rural service provider, can you explain how that can affect the veterans in your community?
Definitely. I think I could go on for probably a couple hours on the benefits that it can provide to veterans in the community. So what the standard rule is for someone who's working under a program like community paramedicine, we call it integrated mobile health, is the patient's provider, their nurse practitioner or PA or doctor at the VA, recognizes that they could benefit from additional care, additional checkups, additional testing at home, a wide variety of things. And we will send care providers out to that person's home. So not only are they getting the services they need without having to travel, it increases the compliancy rate. A lot of people have difficulty getting to their appointments. It makes sure that the proper testing is done. It also gives us a window into that person's home environment and their personal life. So it allows us to give them education that directly benefits them in their environment, not just where their doctor or their nurse practitioner is in the office. It has to give them kind of generic advice that they hope directly applies to them in their home.
All right. Do you have any stories of success that you currently have on your pilot program?
We have had success with veterans on our program, and we finished up some patients that went through exactly through the process I just described. They were identified as being able to have better health outcomes with a little bit more attention. The person had difficulty traveling, and they had some varying experiences with health care, and sometimes they would miss their appointments. So we went out there and sat down with the individual over many visits, built trust with them, helped them build trust between the patient and their VA provider. We did the testing they need. We made sure they got their medicine on time, that they understood what their medicines were for. And we took a patient that was going into the hospital on a fairly routine basis for preventable things and eliminated that, and it gave them quite a bit of quality of life back. And they are very happy. So it worked wonderful.
Now, Jason was referring to the Montana Code where it's Chapter 50 versus 37. Currently, emergency care providers are titled under Title 50, and professional licensing is under Title 37. The medical board has made a big deal of that because if they're titled under 50, it's the Emergency Care Act, and an ECP or an emergency care provider is restricted only to providing emergency care. So this bill that we're putting forward would move it over to Title 37. But before that, how are you able to function and able to do what you're doing?
We've gone through a bit of a complicated process over the last 2 years to make sure that we are remaining compliant with all the laws in the state. We have communicated with the Board of Medical Examiners quite a bit, with the state quite a bit. Everyone understands that we're operating, as are the other agencies that are doing these programs, not clearly within how we've acted before, but it's, we're trying to inch this forward and hope that the regulatory bodies and the legislature kind of catches up with all the programs that are running across the state right now.
So you're not the only program out there?
We are not.
So River is running programs up in the Speaker of the House, Austin Knutson's area, in his district, and he has been very, very supportive of this bill. And he was able to muster the support where we got it out of the House at 89 votes for and 11 votes against, which is pretty exciting. What do you see as the difference that this bill will make for veterans of Montana?
Oh, this is going to fill a huge void in the care that's available, especially for us in the rural communities. We're a bigger rural county in that we're just over 15,000 people, which is still small by almost everywhere else in the country standards. So people can't travel the distances, and one clinic is maybe serving a very, very large geographical area. So making it so that a patient doesn't have to make that full trip to the clinic or to the hospital on such a regular basis, it just, doubles, triples, quadruples their access to care. And it saves those clinic slots and those hospital slots for patients that, do truly need that appointment that day. They don't have a problem that can be dealt with in their house. They need to come in and be seen by their doctor. So not only are we bringing care into people's homes where it's easier for them to get, we're also freeing up slots in the care facilities for patients that need them.
So one word that comes to mind is triage, where we actually can sort out, before the clinic fills up, the patients that truly need it versus the patients that can wait.
It is one way, and then it's also, I mean, it's multiple levels of that. So even if you needed to go to the clinic for that one day, it's then triage again to where do you need to come back the next week, or is it something that can be seen at home? And the ripple effect of that from patient satisfaction to cost savings is just somewhat endless. And I say endless because we have so many veterans in this state and such a need for care that we would need a very large program running for a very long time before we got to caring for everybody that we're supposed to be.
Now, going back to the differences in the licensure, there's been some debate in the legislature currently whether a community paramedicine program belongs to an ambulance service or it should be standalone. When we put this forward, we believed in a standalone program. What's your position on that?
Our position is we can make, for us here, I can't speak for other agencies on this, we could make either one work. A program that's large and helping, several veterans is going to be big enough that it probably would benefit from having its own standalone side, but some agencies can handle that growth. Some agencies would need to break off and, open up, another department that handles that. It gets into individual entities and how they operate. We have enough flexibility here that we can adapt as needed.
Okay, having the standalone provision the way that House Bill 612 allows for a lot of flexibility within the ability to treat the different veterans needing this service.
By having a good standalone program out there, and what it does is it allows one VA clinic on one side of the state and a VA clinic on the other side of the state to both know the services that are available to them for when we go see vets in their homes. If a care provider of a certain certification level can provide this set, of services and this set of services, it makes the whole thing run pretty smooth.
So another concern that they had was by allowing a community veteran ECP program, it kind of gives a boost to the veterans over non-veterans. So there was some talk about, is that fair? Do you want to address that a little bit and what you see in the Glacier County up there?
I don't look at it as an issue of fairness right now. I mean, if this were a law that said if this program works as well as it has in other areas and what we're anticipating it will continue to work as well, the law isn't going to say we can't change how we deliver care to the general public. Let's support this, let's run it, let's use best practices. And if in 1 year, 2 years, 5 years, we have good evidence for what care is really benefiting the people the most for the least amount of money, then let's expand it to everybody if that's what the legislature wants to do. I mean, this is a great test program, and let's use it as that. Let's take the lessons we learned by helping veterans and apply them to everybody. That's the same thing we do with medicine when we go to war. That's where we get our research from for a lot of traumatic injuries. It's unfortunate, but it's what we've done in the past there. So let's help our vets and let's learn from our vets.
You're a veteran yourself, right, Nick?
I am, sir.
Where did you serve?
I am actually still in the Montana Air National Guard. I was active duty for several years, and I was full-time in the Guard for several years, and now I'm what's referred to as a traditional Guardsman.
Oh, okay. Well, thank you for your service.
You're welcome.
I have a statistic from the Rural Health Association that about 75 million people are living in rural or remote regions, and only 10% of the country's physicians practice in those regions. Is that what you're seeing?
Yes, very much so. We have a hard time recruiting people of every certification level, and I say we as in the healthcare community here. It's the hospital, it's the ambulances, it's the nursing homes, it's the clinics, it's everything. I mean, it's difficult to even make people aware that, there's a town on the prairie in Montana. How do you recruit from people from New York? We don't have the high wages that a lot of places do. We do have plenty of scenery and lots of land, but some people want the urban amenities, and we just don't have those.
How hard is it for you to recruit EMTs or emergency care providers in the rural areas?
We have an easier time than a lot of agencies do, and I will still say that it's very difficult. A statewide advertisement for a position will result, at best, in a handful of qualified applicants for a paramedic. Largely for our EMTs, train people from the local community because we can't. We have a very hard time getting people to move in from other areas.
So, in your estimation, by providing this next level of care for EMTs that go through it, and if they could get paid to do this service or even volunteer, is that going to be a hard sell to the EMS community?
No, it's not. The organization I came from before I worked here, I was the only full-time ambulance person in the county. And there was, money's always a problem. Allowing a steady and predictable revenue stream to come into an agency, it's going to be a deal changer for many rural ambulances throughout the state. There's absolutely no doubt about that.
Are you currently able to bill the VA for your services?
No.
Okay. If they were licensed under this program, would that be something that you could do?
That would take us, in my understanding of it, and I'm by no means an expert on legislation, my understanding of it is it would bring us closer to the insurance regulators for the state approving it, and then, it would be a short step from there for the VA to begin to fund it.
What other things do you see out of this bill coming out?
Well, it depends. I see different things for different sized communities. We're for the rural areas that are relying solely on volunteers. It is going to give them potentially more EMTs. It's going to give the EMTs that are there more engagement with patients, more funding. Hopefully, at least a part-time paycheck. There's not a lot of rich people on volunteer ambulances or volunteer fire trucks. We all could use a little bit of income. In the medium-sized places like here, it's going to help us grow the programs we're already doing exponentially because it's going to give us that predictable revenue stream that allows us to get more people, better trained people, better equipment, this and that. And for the urban areas, and they just have, thousands in some of the bigger towns here, thousands of veterans that need help. It's just going to help them start chipping away at that large group of people that just aren't getting the care that they need right now.
Now, we had Mike Garcia from the VA Public Affairs Officer on our show. He said there was about 26,000 eligible veterans for care within the Montana VA healthcare system, and they are not enrolled. Would a program like this be able to help get them enrolled?
Oh, it certainly does. Our program, or the program we're doing here, has already spread some of the knowledge about the VA. We have a large number of men and women from the Vietnam era. It's where the largest group of them are right now, whose previous experiences with the VA don't line up with the modern day VA. And because of that, they don't understand their benefits. They've never pursued them, or they haven't recently pursued them. And we try to teach them about what's available to them now, the quality of care that they can get, the programs that are out there. I just myself have probably counseled 100 veterans up here in the back of an ambulance because I ask them if they get their care through the VA, and they say no. And I take some of the time I have with them to talk to them about how good parts of the VA are right now and how it could help them.
Another quick question for you. The training requirements in this bill, do you think that's going to be hard for smaller EMS services to meet?
It will be somewhat difficult for some of them to meet, but it's going to be achievable. This is important training. It's going to make a big difference in people's lives. It can't be just accomplished, in an hour or two. But the availability of it to produce positive outcomes, I believe, is going to motivate people to go through it and to stick with it. And when we show these rural departments that this is a program that will help them and help the people in their community, they'll make that sacrifice for time, and they'll do the training, I believe. There may be ways that the state, if they actively support this and they make the training easily available in the local communities, that process will go, I think, much easier.
So, Nick, what got me into trying to bring a program like this out is the high number of veteran suicide. I function at the Rural Institute as a veterans clinical suicidologist, and we look at the theories and the ways that we can actually prevent suicide. Do you think a bill like this is going to bring down the veteran suicide rate?
I do think it'll bring down the veteran suicide rate. Because our community is also heavily touched by suicide, and also being a veteran, and still I'm very aware of the high rates of suicide, unfortunately. We know that for many people that there is a considerable amount of time before they make an attempt on their lives, where interventions are beneficial, where we can prevent them from making that attempt. And we also know that people who have people that come out and check on them, meaning that, they almost accountable, that they have lower rates. So if someone's in a position to where they're very depressed and they're contemplating suicide, it may be that knowing that someone is actually going to come out and check on them that week, that cares about them, that may very well be what makes the difference for them. And also, just as importantly, getting our vets more access to care enables them to be screened more thoroughly, so we can catch some of these depressions and suicidal patients before they commit an act against themselves.
In our program, I can identify, and we're not as prevalent in the community, but we can identify at least 11 guardsmen that are alive today because of the program. Do you have any statistics on that?
I don't have any data on it.
Your program. In your program.
Oh, in our program, we don't. I can say that we have a large number of veterans and non-veterans that we are providing similar services to. We have integrated mental health assessment and screening into almost all of our patient encounters. And we do have several patients that their provider has decided that we will help them at home with their depression, and we will screen them and we'll watch them, and we're going to focus on that area in addition to the other medical reasons that we went in the house to begin with.
It's fascinating what you're doing up there in Glacier County, and I'm glad you're doing it. River would like to talk to you offline. We're available to help you and other veterans and other services out in Montana to help develop this, and I'm hoping that we can get together and get this law through, and I'm hoping Governor Bullock will sign it.
Yes, sir. I feel the same way. Anything that helps support our people, I'm all for.
All right. Jason, do you have anything else you want to ask Nick?
No, I think that's about it. Thank you very much, Nick, for your time. We really appreciate it here, and thank you for everything you guys are doing in Glacier County. Sounds like it's very successful, and we appreciate it.
Yeah, it's actually going pretty good. So, all right, if anything else, give me a call.
Thank you.
Thank
Bye.
you, Nick.
All right.
All right, so far we've talked with Nick Bradford about some things happening in his neck of the woods in terms of community EMS and how it's helping veterans and civilians alike. We also talked about House Bill 612. If anyone is interested in hearing more about House Bill 612, please contact us at River at 406-540-2302 or 406-273-8426. And if you are in support of House Bill 612, please get in contact with our senators because it's coming up to the Senate next, and we'd love your support.
For those of you hoping to hear from Governor Bullock this morning, we had a scheduling conflict with the governor, and we're hoping to reschedule him for a future show.
Well, thank you very much for listening to Veterans Heartbeat. We'd not be able to bring this to you without all the support of our listeners. And thank you again to the Man Shop for sponsoring the show. If you're in need of a great haircut, swing on by, get a snip. Also, thank you to our main sponsor, River, the Rural Institute for Veterans Education and Research. They have an array of services such as veterans-focused education and a free TBI and vestibular disorder clinic happening once a week. Check them out on Facebook or on the web at riverofchange.org. Lastly, we would like to show our appreciation to all of our veterans. Thank you for serving our country and keeping us safe.